What is prednisone like at the beginning and at the end of when you take it? Hi, I'm Dr. Megan, your prednisone pharmacist, and I had to take prednisone, and that's what I felt like while on it. But I didn't feel like that every day. Some days I only had some of these side effects, and other days I had other side effects. So when were they? Was there any time relationship to it? One of the type of questions I get more often than other is when? When is it going to start? When is it going to end? When will I feel better? When is it going to kick in? That type of thing. So I wanted to go through the type of side effects you might experience at the beginning and the end of your prednisone journey. So first of all, you might be wondering, what is this? This is a cartoon I drew of myself while on prednisone. And a prednisone warrior found it so helpful that she put it in her memoir, A Change of Heart by Christy Sidler. And so I feel honored. Something I created is in a book. That's just stunning to me. I never thought that would happen. So in here, you can see all these side effects I personally experienced. And now I'm just going to go through each timing and what I went through and what most people commonly go through. So first of all, at the beginning, when you first start taking prednisone, your doctor normally starts at a high dose, and then over time you get lower doses. So the beginning doses can also be because, like, the side effects are because you're also taking a high dose. So for me personally, I had a hard time sleeping at the beginning, and that never really went away for me. I felt so much energy. I like had this euphoria, this enthusiasm, this ability to just get so much done. I had a friend, he said, he was like 85 or something. And his wife was like, he just power washed the trailer. Like, she couldn't believe how much energy he had. So the beginning, you feel great. This wonderful high of energy and mood. And that's because, it's mimicking your body's normal stress hormone, cortisol. At the beginning, Mother Nature wants you to survive whatever it is that's so stressful, whether that's a famine or you're being chased by a tiger or something. And so at first it feels great, but as time goes on, it doesn't feel so great anymore. And you feel more exhausted. That high can become depression. It can become just inability to get up and go. So that's the energy levels. You start out high and you usually go low. Then mood. So I already kind of mentioned the euphoria. Some people can even get anxiety, even after just one dose. And so it might start out as this really high energy anxiety that is just debilitating. Like, can't be around people, can't sleep, can't do anything, feel like you're having a heart attack. And sometimes that goes away quickly, and other times it lasts a while. And then it can turn into depression. Some people, it's so bad, it can actually be like psychosis. So if you're ever having mood problems while on prednisone, just know it's not you, it's the drug, and get help from your doctor. Okay, so we talked about that. Sleep, relationships. Okay, so relationships. You need to tell your family and friends that you're taking prednisone because you might not be yourself for a little while. So tell them, hey, I'm taking a drug that changes my personality, and I apologize if I'm not quite myself right now. Then the weight gain begins. So at the beginning, you might feel the munchies a little bit, but the weight gain doesn't necessarily start right then. The earliest I've really heard anybody gaining weight is after a week, but for most people, it's not until after a few weeks, several weeks, that the weight gain begins. And it's not just from it causing you to feel so hungry, it's also because the water retention. So do whatever you can to eat like you used to before prednisone, right? All right, the thing is, that can cause diabetes over time, longer term. Those high blood sugars, that weight gain can turn into diabetes long term. All right, then as time goes on, for people who take prednisone more than 3 weeks, you need to start worrying about bone loss, because prednisone is the #1 drug that causes osteoporosis. And the highest withdrawal of calcium and minerals from the bone is within the first 3 months of taking prednisone or any other steroid. So you should begin taking calcium and vitamin D and other minerals as well to support your bones over time. Then you can also start losing muscle mass over time. You won't see it immediately, but if you're like me and you had to take it 9 months, you'll suddenly see that your arms and your legs are getting really thin while your belly and your face are not. They're getting round. So that's how it was for me. Some other people get like a buffalo hump, a fat pad on the back of their neck, shoulder area. And that's not fun, but it doesn't happen instantly. It takes time. Then, as time goes on, you're hopefully going to be able to taper off. Some people are on prednisone for life, like if they have a transplant or something. But most people eventually want to get off. And so that leads to the side effects of tapering, which are not fun at all. For some people, they can just go off prednisone slowly and have no problem recovering. For other people, just a 10 or 20% drop in dose can be excruciating. It's called prednisone withdrawal. It can feel like incredible aches and pains, joint pain, muscle pain. The withdrawal can be so bad that it can feel like you have the flu, that you're stuck in bed and you can't find the energy to get out of bed. And it is awful. And it's really hard to distinguish between prednisone withdrawal and prednisone causing adrenal insufficiency. And so you should work closely with your doctor when you're tapering, and never go cold turkey, because if you do so, it can actually potentially be fatal with an adrenal crisis. So always taper off slowly and deliberately, and not all at once in one day, over at least a week, if not more. Unless you're on prednisone for less than a week, then between you and your doctor, you can decide whether you need to taper or not. So those are the types of side effects you can experience over time while on prednisone. I'd love to hear what questions you have about it. And thank you for liking and subscribing for this video. And then if you would like to know more about these side effects, please fill out and take the prednisone mistake quiz. I created a quiz and it's called "What's Your #1 Prednisone Mistake?" And if you go, you can find out precisely which mistake you're making in your prednisone journey. And then I have specialized information about how you can overcome that mistake. Just click the link below and you can take your #1 prednisone mistake quiz. Signing off as Dr. Megan, your prednisone pharmacist.